Our next presenter, who just got here, was over at running around at Brown, is Dr. Nicole Alexander Scott. I keep messing up her name, I apologize for that. She is the Consultant Medical Director of the Office of HIV/AIDS, Viral Hepatitis, STD, and TB at the Rhode Island Department of Health. She too also has a very lengthy CV, but like Dr. Fine, she's very humble, and I won't go into that because that would take us long for talks.
Dr. Paquette said that it's uploaded, so we will just grab it. Thank you. Great. So we will get started. You know, my quick background is that I am an adult and pediatric infectious disease physician. I'm honored to have the opportunity to speak before you, and I want to make this an interactive discussion as we go forward. I'm going to delve in a little bit more to some of the clinical details and some of what's going on at the healthcare level, really so that you have an understanding of the preparation that's involved, both from a public health standpoint as well as from a clinical standpoint. And then we can also talk a little bit about travel and how some of this may impact you or loved ones that you have, and how we can work through this together. So definitely catch my attention if you have questions and want to go through anything in more detail. And I'll let Dr. Paquette keep us on par with timing. All right, so we're going to go through a little bit of the clinical course of Ebola. We're going to get into some details. Also talk somewhat about the public health emphasis and what is possible for us to do in terms of preventing further spread of an outbreak. Address some of the travel concerns, talk a little bit about some of the lessons learned from recent cases in the US, and then some specifics on evaluating Ebola in Rhode Island. So some of the clinical signs and symptoms, as you could imagine with Ebola, hemorrhagic fever, the early signs and symptoms are somewhat difficult to differentiate from other viral illnesses when it first starts. It's not easy to tell up front, okay, someone has symptoms consistent with Ebola. You can have fever, chills, muscle aches or body aches, which is myalgias, overall tiredness, which is what malaise refers to. And because of these very non-specific symptoms, Ebola can oftentimes be confused with other common infectious diseases. We're very familiar with flu-like symptoms from influenza. Also, travelers may have malaria, typhoid fever from Salmonella typhi, meningococcus, which is another bacterial infection that can cause pretty severe disseminated infection, as well as other bacterial infections. Just presenting with pneumonia within itself can have some of those non-specific symptoms. After about 5 days, the non-specific symptoms can develop into specific gastrointestinal symptoms. It still doesn't say this is specifically Ebola, but this is what can happen during the presentation. You can develop severe and watery diarrhea, nausea, vomiting, and abdominal pain as well. Other symptoms, also very nonspecific, include chest pain, shortness of breath, headache, confusion can also develop. Patients may have redness within their eyes, which is what conjunctival injection refers to. Hiccups have been reported in some of the later stages of disease, interestingly enough, as well as seizures or swelling in the brain. Bleeding does not usually happen, but it can occur later on in the illness with Ebola. So the most common signs and symptoms that have been reported from the current outbreak related to West Africa include fever in 87% of patients, fatigue and tiredness in 76%, vomiting in 68% of patients, diarrhea in 66%, and loss of appetite in 65% of patients as well. All of which are still very non-specific. There are no approved treatments for Ebola. There have been some things that have been mentioned as being tried on the news, but none that have been proven for approval as a standard. The standard clinical management does focus on providing supportive care, as we call it, to address complications. So with some of the cases that have occurred, patients have had significant changes in their volume status, the amount of their blood flow through their body. Some of that has leaked out into the tissues just in terms of maintaining an adequate amount of blood flow through their system. And so it requires continually monitoring how someone is doing and monitoring their electrolytes like sodium and potassium and calcium and making adjustments as needed. Sometimes symptoms can progress further with or without that supportive care that can lead to some of the other symptoms that can result in multiple organ failure. The goal, though, is to provide the supportive care to help someone get through that process, to keep their fluids balanced so that they don't go on to the more severe forms. So the recommended care includes volume repletion, so giving the fluids that are necessary to keep someone balanced as fluids are coming out with diarrhea or vomiting or leaking from the blood vessels into the tissue. You can replace that with IV fluids or other mechanisms of keeping someone balanced, and use that as a way to maintain their blood pressure as well. Pain control, making sure that someone's nutritional support is maintained is also important, and protecting them from having other secondary infections, like bacterial infections that can occur. So among patients who have been medically evacuated from West Africa with Ebola, large volumes of intravenous fluids have often been required to correct dehydration due to diarrhea and vomiting. So those are really the main issues that we are working on addressing, and that's something that it's possible to do, able to do once someone can get into the appropriate healthcare system to provide that. So as Dr. Fine had mentioned with his summary, the outbreak can be stopped with good public health practice, in addition to some of the clinical support that was mentioned. While we may see a few imported cases in Rhode Island, good public health collaboration can likely prevent further spread as a potential. So I thought this was an important and probably one of the more important pictures to share with you. This is something that can be communicated with colleagues. We all have friends, some of us loved ones who have traveled to some of the countries that are unfortunately experiencing this outbreak. And this provides a guide on what to do for those who return and what's important. So if someone were recently within one of the 3 most prominent countries that have been mentioned with Ebola, Sierra Leone, Liberia, or Guinea, if they've returned for the first 3 weeks, the 21 days after their return, they are to watch closely for any of the non-specific symptoms that I've mentioned for the potential for developing Ebola. If they haven't been exposed, the potential is low, but it's important to be aware of what the symptoms are to watch for. So that's one of the first steps, monitoring for fever, headaches, or body aches during the first 21 days that someone returns. That's your first key. If someone were to get sick with that monitoring period, within that self-monitoring period, it would be important to call a doctor and let the doctor know where you have traveled. And then with that, the doctor can work alongside the person who has traveled as well as the Department of Health to coordinate the next steps for evaluation from there. So we talked a little bit more about the travel component. Ebola in Liberia, Sierra Leone, and Guinea has led to the travel warning level 3. And so CDC urges all U.S. residents to avoid non-essential travel to those 3 countries due to the Ebola that's there. So to the extent that it's possible, communicating that with friends and loved ones is helpful as well to be able to limit travel. In terms of what Liberia is doing, the government has instituted enhanced measures to combat the spread. There are steps that are taking place slowly. There's certainly more still to be done, but it's helpful to be aware of some of these changes. So all of the borders have been closed except at major entry points in Liberia, the Roberts International Airport, the James Briggs Payne Airport, Foya Crossing, and Bow Waterside Crossing, as well as Ganta Crossing. They've also instituted prevention and screening measures at entry points that remain open. So these travel policies will help restrict travel among incoming and ongoing and outgoing travelers, as well as trying to restrict communication or restrict getting together in public or other mass gatherings in order to try to minimize further spread. In Sierra Leone, the government has instituted enhanced measures to combat the spread by starting new protocols for arriving and departing passengers at their Lungi International Airport. Restrictions on public and other mass gatherings have also occurred as far as adjustments, and measures for communities affected by Ebola to also limit further travel in and out of specific communities until a medical team can provide care to evaluate. The Sierra Leone government also has authorized house-to-house searches to locate and quarantine Ebola patients. They've also authorized police and military personnel to help enforce those and other prevention and control measures. Required local government officials have also been asked to establish laws to support Ebola prevention efforts as well. And then in Guinea, these are some of the specific areas there that have been affected, and the public health infrastructure is struggling and working hard to try to respond. But it's certainly challenging, we can imagine. So if someone must travel, consider it essential, because we're trying to limit any non-essential travel. There are a few things CDC suggests are possible to do to limit your risk of exposure, so you can check with the health insurance plan. For anyone who's traveling to countries where outbreaks are occurring, make sure that full coverage is in place and something that includes emergency medical evacuation. Also, practicing careful hygiene is important, washing hands with soap or water, and avoiding contact with blood or bodily fluids to the extent that that's possible. For additional considerations, for sure can avoid direct contact with anyone who has had Ebola, or being careful to make adjustments at funeral or burial rituals. And for people, there are family members who are abroad, being able to seek medical care immediately if they were to develop fever or other symptoms that are concerning that have been mentioned. And so limiting travel even while there is also recommended. So in terms of traveling to countries where an Ebola outbreak is occurring, it would affect ability to return home. The process would be altered in the sense of travelers are being screened at the airports to look for signs of Ebola and to find out if persons have been exposed to Ebola, even if they are not sick. And so those who have been exposed could be evaluated for further assessment, and their travel on flights would be limited. Screening at the airports can look different in different countries, and people are often asked to answer questions about possible exposure. And then after the screenings, the authorities work closely with the traveler and can decide how to help them and when it's appropriate to continue the trip or not. And after returning to the United States, if someone were to be exposed to Ebola during their trip, it would be important to call your doctor, call physician in advance, even if you don't have symptoms, to let them know. And the doctor could evaluate for exposure level as well as symptoms and communicate with the Department of Health to determine what would be best, just self-monitoring or going from there. So it's important for all of us to pay attention to our health, but particularly after returning, whether or not someone has been exposed to Ebola, monitoring their health for 21 days, being clear that it's particularly after travel to Liberia, Sierra Leone, or Guinea, and watching for the Ebola symptoms. If one's temperature is 100.4 or higher, or there are any of the other symptoms that are there, as mentioned, you call your doctor immediately and let them know about recent travel, as well as the symptoms that exist. It's important also to limit contact with other people, particularly as the communication and plan with the doctor and Department of Health is being established. And during the time of self-monitoring, it is fine to continue normal activities, including work, as long as someone does not have symptoms. As mentioned earlier, Ebola is only contagious for those who actually have symptoms. So that's why the monitoring is key. So to go on a little further about what we're using at the public health level to determine a person under investigation for Ebola, there are multiple steps that are oftentimes involved in assessing for it. It's not straightforward because, as you saw earlier, symptoms can be very nonspecific, and that's where the education amongst ourselves is key. Being aware of which countries are involved, being aware of recent travel within the last 21 days, and being aware of the symptoms to watch for. So the CDC uses the following case definition to determine a person under investigation. And you've heard a lot of different components in the news. There are sometimes people who don't necessarily have Ebola or haven't been confirmed for it, but have been considered a person who is being investigated for it. And some of that is for these reasons. You first have to have a person who has symptoms as well as risk factors that are consistent. So the clinical criteria, as we've mentioned, for the symptoms include fever or severe headache, muscle pain, vomiting, diarrhea, or abdominal pain. But they also have to have epidemiologic risk factors. So having traveled within the past 21 days before the onset of those symptoms, and then during that travel having contact with blood or other bodily fluids or human remains of a person who was known to have or suspected of having Ebola, as well as having residence in or travel to an area where Ebola transmission is active. So in order for someone to be considered a person under investigation, they have to have those symptoms mentioned, but also have these specific risk factors that are required. Someone would be considered a probable case if those risk factors are high or low risk exposures, and I can go through that list if it's helpful. Someone is not considered a confirmed case until a laboratory test has actually confirmed the presence of Ebola. And the way the disease unfolds, the preference is not to get the laboratory test until at least 72 hours of symptoms have occurred, because before that the tests may sometimes be negative. So it does take time. For the high-risk exposures that would require someone to be considered a probable case, it would include having a needle stick or exposure through various mucous membranes in your mouth or your eyes to blood or bodily fluids of an Ebola patient, as well as having direct skin contact with or exposure to blood or bodily fluids of an Ebola patient. So most people who have traveled at this point don't fulfill those high-risk exposure criteria. In terms of low-risk exposures, it would be someone who is in actual household contact with someone with Ebola, or having a direct brief contact with an Ebola patient while not wearing the recommended personal protective equipment that has been mentioned. And then most people that we have encountered within our state are folks who have traveled but have had no known exposure, which significantly decreases their risk of having Ebola. So I just wanted to touch briefly on what's some of the lessons that have been learned in Dallas, if there was an interest in discussing a little bit of the clinical side of what you've been seeing on the news. So the Centers for Disease Control and Prevention, as you know, there have been 2 additional cases of Ebola in Dallas, and with that they have increased, the Centers for Disease Control has increased their support offered to Dallas. So in addition to the initial team of 10 public health professionals who went to Dallas on September 30th when the first case was known or identified, they provided support with contact tracing and the response, public health response that occurred from that for the Ebola patient. But since then now, CDC has sent new resources to Dallas to support the highest standard of infection control. And that's really what all hospitals that have the capacity are striving towards reaching, essentially. CDC has deployed a second team of 16 public health professionals to Dallas to train and assist the hospital in infection control as well as monitoring of healthcare workers who had contact with the index patient that was there. The additional CDC team experts include experts in infection control, those who have had years and years of experience in Ebola virus control and infectious diseases, laboratory science experts, as well as those who have expertise in personal protective equipment, hospital epidemiology, and workplace safety. And so they're really using it as a time to learn and understand what can be done better and how can we make sure that we prevent any further spread going forward. The team, it also includes experts who successfully controlled outbreaks of Ebola in Africa in the past 2 decades, including in various healthcare settings. So CDC is assisting the hospital in rapidly reducing the risk of further spread of Ebola, as well as investigating how the healthcare worker who was there may have become infected with Ebola. And the team is looking into what personal protective equipment is being used so that we can understand what's the best option for keeping healthcare staff protected, what's the best mechanism for removing and placing on personal protective equipment. It can be somewhat challenging, but is definitely doable, as has been demonstrated in Emory and Nebraska. They're also looking at what medical procedures were done on the index patient that may have exposed healthcare workers to Ebola, and then ensuring oversight and monitoring of an infection control practice going forward, particularly with putting on and putting off personal protective equipment. And this gives an outline of some of the aspects of personal protective equipment that healthcare workers are wearing and learning how to manipulate appropriately and safely. It is an ongoing learning process. You have to have a gown that's placed properly, but then also removed in a way so that it does not lead to any self-contamination. Being able to also place a mask or respirator on properly, as well as goggles or face shields and gloves as well. Once these are done appropriately with maximum isolation, it is possible to prevent further spread and make sure healthcare workers are protected, and then also help patients receive all of the care that they need towards recovery. So I'm going to stop because I'd really like to get a sense of what you all are processing and what you would really like to discuss and learn. I had an idea in mind of what to present, but I think it's more important for us to have the opportunity to address what you would really like to know more about and understand, and how we can help with that. So, you know, Ebola is a serious disease, as we know, but there is the opportunity to control the infection together, certainly here and hopefully with our friends and loved ones in West Africa as well. Thank you.